Test 1, 2, 3. Here, right? Ah, okay. Yeah, good idea. No, I thought you're advancing. Oh, I'm advancing. Oh, yes, I'm advancing. How can I do so many things? Thank you. That is good. Okay, I'm ready, if you're ready. A very good afternoon to all of you. We are so thankful that you're able to join us in this session 2 of the Hydrotherapy series. For those of you that may have missed us a few months back with our session 1, which we actually demonstrated on the hot foot bath and also the steam inhalation, you may be able to find the YouTube recording in the Maranatha website. So do tune in and, or rather do edit and find the program in the Maranatha website and YouTube channel. Today, we are going to talk about 2 other hydrotherapy treatment. One is on contrast bath. Okay, the first one is on contrast bath, and the second is on the ice pack. Yes, ice pack. Yes, that's the thing that we're going to talk about, ice pack. Now, before we go there, I'd like to remind all of us the certain key principle of hydrotherapy. First of all, for those audience over here, what is hydrotherapy? Can we remember these so-called Latin terms that we have? Hydrotherapy. If you break the word in part, hydro is the water, therapy is the treatment. So basically using water for treatment. And I think we are blessed and be reminded that God has given us this amazing water, the element of water that exists in several forms, and as a result, we can actually use it for different purposes. For example, when the water is hot, or even to the extent of converting to gaseous state, steam, or when it's in the cold state of solidification, ice. Both are used for various purposes. So let's be able to use this form of the water in their various state for the different purposes. Now, when we talk about that, how does the water in the different state help with our treatment? Our body responds to the whole cold and hot in different way. So if you recall, the last time, we have this picture that shows us that on your left, is the blood vessel in a normal state. On the right, when heat is applied, that's when we see the dilation of the blood vessel. So with this effect, then more blood will be able to be circulated through those vessels. So that's why the heat comes into the picture, whereby it can actually dilate the vessel and more movement of the blood. On the other hand, again, on the left will be the normal vessel, but when cold is applied, that is when the constriction happens. The constriction is when you restrict the blood flow, and at the same time, you send the blood away to another part of the body. So that's why we are very thankful for this physiological effect of hot and cold, and with the various state of the water to actually apply these into the hydrotherapy treatment. So yes, before we go into there, today we are reminded of contrast bath. The word itself actually told us, give us a hint what it meant, contrast. Contrast between one and the other. Contrast between hot and cold. So in definition, let me show this again. In definition, contrast bath is basically an immersion of the body part alternately in hot and cold water. And then if you are not able to immerse those body part, you may actually be able to use the cloth, be it a hot or cold cloth, on certain of the body parts. So that's how it works. Then when it comes to contrast shower, will be the same principle, but instead of actually immersing it or applying the cloth, it's actually using the water that you spray on. So for example, if you spray on the hot water, the effect will be the same as you submerge something in the hot water, or when you actually spray on the cold water, so it will be the same. So this is how actually the whole contrast bath or contrast shower concept is derived. Now, let's take a look now in the actual way of doing it. For example, the lady on your left is talking about treating the hand. That's why there are two pails of water, one hot, one cold. The gentleman on the right will be treating on the foot, which is one hot, one cold. Now, how does all this thing work? Basically, the principle is this. If I may use the word, our circulation of the blood is using a transport system, which is the blood. And when the blood is able to go to one place, more blood is able to go to one place, that's when the dilation happens. And when there's a need for us to remove certain of the thing from one organ, that's when the constriction happens. So that's why by enhancing the supply of oxygen and nutrient, which is what the transporting is doing, is helping our circulation to be enhanced. And at the same time, in the whole process of the circulation, while we include or bring in the nutrients and the so-called oxygen, at the same time we need to get rid of the waste products or the carbon dioxide. So the whole process of circulation does that way. And last but not least, of course, is the white blood cell. Those army of ours that is being circulated in the whole system by virtue of the transport system of the blood. So the whole contrast bath is best done in this way, because the hot is where we actually dilate and we encourage more blood to flow into a certain organs that you are concentrating on. For example, the hand or the leg. You want to have a dilation of more time, so 3 minutes. So the whole cycle is about 3 minutes hot, 30 seconds cold. 3 minutes hot, 30 seconds cold. Or you can say it as 3 minutes hot, half a minute cold. So it can be 3 to 5 cycles, depending on the severity of what you need for the part of the body. The indication, when can we use a contrast bath and when should we not use? So when we can use it, that's called indication. Then contraindication is when those conditions, you be careful, don't use contrast bath. Indication, when you have infection, when you have certain area of the body is infected and you want to encourage bloods to come to that area. So that's how you are able to, for example, for this case, there's an infection near the feet. You want to actually, near the foot, where you have submerged your foot into the water, and then more blood will be drawn towards the foot. And as a result, it will help with that near the area where the submersion is, and then the infection will be treated in the sense that there are more blood and more nutrients and more white blood cells that will come to that place. Secondly, I need to change the next slide. Okay, secondly is when you have injury. injury to your muscles or to your joints. Those are the time where you also want to actually encourage certain warm or hot to a certain area. For example, in this case, your ankle, maybe the area that you want to. So sprains and strains or injury is when we can do it. However, do take note for certain of the injury like sprain and strain, you want to have first the ice treatment to numb and clear the area first before we do the actual contrast bath. Third one, arthritis. Okay, you see in the picture there, when you have arthritis-related episode, contrast bath is also useful. Next is fracture. Fractures are same thing. Principle is to encourage healing in that area, but do take precaution. When it comes to fracture, it must be at a state whereby the so-called joint is already stabilized and we are able to encourage blood flow there. If you are on a cast, of course, that is not possible. But what we are saying here is for some kind of fractures where your joint are stable and you are able to apply these to encourage blood flow and at the same time encourage the healing process. Next is swelling. Swelling in the sense of, for example, edema, there's fluid retention. Do take good care when you do hot and cold contrast for swelling. I'll explain more about it later on in the safety precaution when it comes to swelling. Indication, headache. One of the things that we usually will encounter, there's just too much congestion up at the head, and we want to relieve that from the head, and then we want the blood to flow down. That's why the headache part is important. All right, and then the last, of course, is the poor circulation to legs and feet, the ulceration. This is also a time where you can actually use contrast bath. Contrast bath precaution, very important, because the main thing that we're dealing with is hot and cold. Okay, but under certain circumstance, your sensation of hot and cold is not as accurate or not as sensitive. That's when you're not sure whether you are sensing too hot or too cold. So for cases of loss of feeling, poor circulation, or neuropathy in diabetic patient, be careful how you define hot and cold in these folks, because we have to be sure that whatever we are feeling is not whether they are feeling. So when it comes to this mode, then let's go with not hot and cold, but rather we go with warm, warm or lukewarm, warm or mildly cool water. So that's when we are able to tell. So always remember certain indication, we must be cautious what we do, because certain of the sensation is compromised for certain of the condition, like with what is mentioned there, lack of sensation, diabetic, or certain situation whereby they are not able to sense properly. So when it comes to that, please remember to use not the normal hot or normal cold, but rather a mild, warm or cool water to have that contrast. Okay, using the warm and cool where there's loss of feeling or when there's poor circulation, and especially for those we are talking about just now, the edema, when you have fluid retention, the edema, your sensation will be different. So that's why we have to be extra cautious about it, even though the whole effect is there to help with the circulation. All right, another thing that we need to watch out for is when there's infection. Okay, when there's infection, we have to be cautious because we don't want it to spread from one place to another, one person to another. So to be extra careful when it comes to so-called using the hot and cold. Reason being, for example, after using the basin or the cloth or things like that, make sure it's properly sanitized before it's used again. So things like that has to be careful, and especially when it's open wound or hemorrhages, we have to be extra careful about the so-called transferring of infection to another person or another spot of the body. So yes, these are the precautions that we have to be aware of when it comes to contrast bath. Okay, this is the simple set of equipments that we need. 2 basins, one for the hot, one for the cold, and then of course the towels to wipe it dry. And lastly, of course, is a pitcher with hot water or cold water so that we can add on to it. Our body actually so-called adapt and normalize after a while. So the hot water that you pour in after a while, actually your body can feel that it's adapted to it. So we need to add on more hot or more cold. So this is when you need the two other pitcher, one with the cold water, one with hot water, to actually go about with the whole process of 3 minutes hot and 30-second cold. So it's listed here. Let me read again. 2 large basin, one for hot, one for cold, and then one tea kettle or a pitcher for hot and one pitcher for the cold. And then sometime if you need, ice will be even better because that will help with the cold part of it. Optional, if the person feels cold or the person is not feeling well, you might want to have a sheet or blanket to cover. And then make sure that the place is left clean so that the person will not fall. So we have to be careful when it comes to this form of treatment, especially if you deal with water. Water, after all, have reduced friction, and then it might cause someone to fall. So these are the equipment that's needed when it comes to the contrast bath. So here we go. Let me go back to that again. And we are very happy today to have our presenter, Diana David. She helped us with 2 of the demonstrations the last time, and today we are happy that she can now help us to demonstrate again how to proceed with a contrast bath, either on your hand and also on your feet. So we'd like to pass the time to her, and she can show us the whole process, whole cycle, and all the equipment that's needed. Thank you very much.
All right, so we're going to do a contrast bath, or alternate hot and cold, and we're going to do it on the hands, just for demonstration. If there are certain parts of your body where you cannot submerge in the water, you can actually use towels and rinse from the hot and from the cold and put it over that body part that you want to have healing quickly. For example, like if you have pink eyes, you can take a towel and you can just rinse it from hot water, put it over the eyes. After 3 minutes, you take another towel wrung from ice cold water and put it back on the eye for half a minute and repeat the cycle at least 3 times. But we will do a demo on the hands. So if you have arthritic hands, or you have a wound that is slow to heal, what contrast baths do is really a principle of physiology, where by putting the hands in hot water, the blood vessels expand and blood comes into the blood vessels. Yes, she's putting in her hand and she will keep it there for 3 minutes. When the blood vessels expand, more blood comes to the area. Now, blood carries oxygen, blood carries water, nutrients, white blood cells, things that are good for that injured area to provide what is needed there. And as metabolism goes on and waste products are formed, then after 3 minutes, when the hand is put into the cold water, the blood vessels constrict, and that pushes the waste matter out from the blood vessel into the circulation. So you are actually hastening the blood circulation, okay? So we keep it longer in the hot, and we always start with the hot, and we always end with the cold. Okay, so we are actually doing this as a real treatment now. So we are keeping to 3 minutes, and we will then transfer the hand to the cold for half a minute. So this pink pail here or basin represents hot water. We have already put hot water there. The blue one represents cold water, okay, ice cold water. So initially you may start with a milder temperature, and then as the treatment proceeds, you can actually make it hotter for the hot part and colder for the cold part. Because the greater the contrast in the temperature, the greater the effect, okay? So while she's still soaking her hand in the hot water, I will put some ice water in the other basin. So we have some ice water here. If you have a pitcher, you can use a pitcher. If not, you just pour from ice water. If some of the ice get in, it's okay too. Okay, so we have a kettle of hot water here and a pitcher of cold ice water there to add on as we need to. So usually we start with half a basin full of water, all right? Half, and then we add hot water to it when we are ready to start the treatment, because we can't prepare too early, otherwise the hot water will get cold. And so this is almost 3 minutes. As you watch her hands, if you can see, they will be, it will look pink or redder because the blood vessels are expanded and more blood has gone to the blood vessels there. Okay, so now 3 minutes up, she's going to put her hand into the cold water, submerge into the cold water. And this one is faster because it's only half a minute or 30 seconds. Okay? And then while she's doing that, I will quickly add more hot water to this. So each time it's hotter and the body adapts. So it can take more heat. Okay, so half a minute, 3, 2, 1, come, let's change. Back to the hot, okay, 3 minutes hot, and we repeat this, hot, then cold, at least 3 cycles. You can even do 5 cycles, okay, or more. And you usually don't expect that once, you know, having done the whole cycle once, it's enough. If you want better results, faster results, you should do more than once a day, preferably even 3 times a day is possible. Okay, sometimes, depending on our age and the severity of our injury, it might take several days before there is complete healing. So, but you should be able to see some improvement along the way. So do not be impatient or upset, or you know that you don't get fast result or immediate result, because nature works gradually but surely and without any harmful side effects. Okay, so as I said, when the hand is immersed in hot water, the blood vessels expand. By doing that, more blood comes in. So you want fresh new blood to come in and bring the good stuff, okay? And you want more oxygen, more nutrients, more white blood cells to help with the fighting of the infection or with promoting healing. And then as the hand is then submerged into cold water, it will, the blood vessels will constrict, and that will push out the waste products, okay? Because carbon dioxide will be formed, waste products will be formed, and that has to be got rid of. So the idea is, while blood brings good things to all the cells of the body, blood also carries the waste products away from the body, and circulation keeps going on. All right, and so that's what you are doing, is actually helping to hasten blood circulation. If I remember correctly, in our first session, we mentioned that perfect blood circulation equals perfect health. So if you have good blood circulation, your extremities will be warm, your hands, your feet will be warm, and you will not get chilled easily, and you will be in good health. Okay, so people who have sluggish circulation, poor circulation, are more susceptible to infections, to getting colds, and other problems. So it's good to have good blood circulation. Of course, our blood circulation is also affected by what we eat, whether we exercise, and our total lifestyle. Okay, so now 3 minutes up, we'll go back to the second, to the cold. So this is the second round, and we'll do one more cycle. So we will have 3 times that we move from hot to cold. Okay. I'm going to pour more cold water. You can take it? Okay, good. It's good to check with the person you're working with so that it is to their tolerance level. And this is already cooled down. So I'm going to add more hot water to this hot tub. This will be for the last round. Okay. Okay, you may change now to the hot. 3 minutes, another 3 minutes hot.
Diana, I think
Yes.
there's a question here. For example, if there's, as you mentioned in the slides just now, if there's an infection, maybe near the arm area, so what precautions should we take when we deal with the hand during the contrast bath?
Okay, if there's an infection, you make sure that the basins are clean, and you can, after you have done with the treatment for the person, the whole thing must be disinfected, okay? And you don't want to spread infection to others, so you can use some disinfectant to clean up the thing. Or preferably, it's best if you have the same equipment for the same person, and different ones use different basins or containers. But in a family, if you want to recycle the same basins, then make sure that you disinfect between use, okay? And so this is one way to prevent spread of infection.
Okay. And just now, we also have a question with the precaution. For example, if Nirina is diabetic and have not the most accurate sensation, how do we help her tell the hot and the cold so that we can actually adjust? Instead of being hot and cold, it must be actually cool and mild warm. How do we relate that to the patient?
Okay, we do tell that we are cautious in case we don't want to burn anybody. We don't want to also have it so cold that they are frostbitten. So for diabetics, for people who have poor circulation, especially in the peripheral blood vessels, the hands, the extremities, the hands and the feet, or if they have peripheral diseases in the feet, then we would want to use warm instead of hot. So one way to tell is to use a thermometer and actually measure the temperature of the water. Okay. Another way is just to be more careful. You know that it feels not even hot for you, but slightly warm. You can start with that. And so it's better to err on the side of caution. Okay, and so the water should be warm, not hot, for diabetics and people with poor blood circulation, and the water should be cool rather than ice cold. Especially for people with arthritis, it's preferable if you don't use ice, or you keep the person warm after the treatment, dry and cover and rest, just to make sure the person doesn't get chilled. And another thing is make sure the environment, there is not much air, no draft or wind blowing. Okay, it's time to change now to the cold. This is the last set that we'll do. This is the third round. So this is the cold that she's soaking in for half a minute. Okay, so are there other questions?
So you mentioned that we should always end with the cold and then dry the person up.
Yes, that's right. Yes, we don't want people to feel wet. It's uncomfortable. We want people to be dry after treatment. And for this, it's not really necessary that she rests at the end of the treatment. But if the person isn't feeling well, then that would be a good thing to do. Yes, so this 30 seconds have gone. So now that we are done, we're just going to dry her hands. Okay, make sure that she is totally dry. All dry. Okay, so yeah, she has a reaction. It could have been even redder if the water had been hotter, but we were cautious. So we didn't use really very hot. So this is very simple. You can do this on the feet. You can do this on any part of the body that can be submerged.
Okay.
If not, then use hot towel and cold towel. Okay, and just do the same timing, 3 minutes hot, half a minute cold.
All right. Thank you very much, Diana. If any one of you have any question pertaining to this demonstration, you can actually put it onto the chat, and we are more than willing to actually answer them later on. So let me let them clear up this to prepare for the next demonstration. I explain about the next therapy that we're going to do for this moment. So give me a second. Thank you, because we were trying to do some shifting of the demo sets so that we can actually demonstrate to you the next therapy, which is the ice pack or ice compress. Meantime, if you have any questions pertaining to the contrast bath of hot and cold, or contrast shower, or contrast of the area of hot and cold using towel, just again put it on the chat so that we can actually be able to answer those questions once we are done with the demonstration. Ice pack or ice compress, as you can see from the picture, basically is using the cold part of the physiology response to deal with the treatment. So using the ice. As we have mentioned, ice constrict, and the purpose is to actually let the area where it's infected to have actually movement of the blood away from where the treatment area is. So it's a continuous and very cold application to prevent swelling, or we call it a blue-black effect, which is due to the rupturing of the blood vessel. So that's the purpose of the ice pack. Now, physiological effect, which I've mentioned a little while ago, contraction, and it's basically slowing down the oozing of the blood into the injured tissue, or to prevent the edema, the swelling of the area. And secondly, of course, is to decrease the inflammation or the muscle spasm that may take effect as a result of the injury. Thirdly, decrease the capillary permeability. Okay, the capillary permeability relieves the pain, and the penetration of the coal is actually quite deep, and as a result, you also reduce the bleeding. So these physiological effects are all working in the effect of the ice compress, though it's cold and actually, in a sense, deep, but its effect is also more lasting. Okay, what are the indications? When can you use this ice compress? When you have muscle spasm, when you have inflammation, when you have pain, or when you have traumatic injury. Those are the time when you can actually use the effect of the ice compress. Now, the indication is also when you want to prevent any kind of swelling and there's internal bleeding that's going on, so you want to actually do that. Or you have acute bursitis, either at the shoulder or the hips. Those are the area that you can do it. Or acute joint inflammation due to rheumatic fever or rheumatoid arthritis or acute infectious arthritis. And you can also use that over the heart and the chest to slow down the heart. Okay, so that's the way to actually use for the cold pack or cold compress. So these are the indication. Now comes to the contraindication, hypothermia. As in hypo, it means low, thermia, cold. So when the temperature is low and you're cold, don't do that, because already you're cold. You don't want actually to use a cold compress for the treatment itself. Peripheral neuropathy, so you don't have sensation, and at the same time, especially at the extremity, so that's when you don't use it because you can't sense it. And lastly, you're in a state of shock or collapse. So there is also not a time, because the ice cold effect is really quite a so-called shocking state for the body. So if you're in that state, don't do that. And cold intolerance. Some people are just, we are all different. Some people are not able to take cold as much as some other people. So if that person cannot handle too much cold, don't use this treatment. And disease associated with impaired circulation. For example, if the person has actually very poor circulation, then don't use this. So let me repeat again: hypothermia, neuropathy, state of shock or collapse, and a cold intolerance, or disease associated with poor circulation of the blood. Don't use this cold compress. Equipment needed. You can see here on the list is a flannel, and finely crushed ice, plastic, towel with safety pin, and stretchable bandages. Okay, the purpose will be explained later, but basically is to have a way to actually wrap the ice around while able to keep it there for a prolonged period, and at the same time not wetting the floor or endangering anyone. So this each has its purpose. Okay, so let me read to you. A flannel about maybe 8 or more inches is meant to wrap around certain part of your body, and then crushed ice, plastic to actually contain the ice, and towel and safety pin to actually hold it further, and lastly, some kind of a bandage to secure it. Treatment procedure, I will just read through it now before Diana were to actually demonstrate on one person. So always remember, cold is penetrating and deep, so it can be shocking to a person. So please explain that whole thing, how it's going to feel like, to the patient. And then place a flannel over the part to be treated. Apply the ice pack, because we don't want to actually apply directly on the skin. So we actually have a flannel over it, then put the ice pack. Then we put a plastic to cover it, to contain the ice so that it won't actually be spreading around. and the person is on bed, use another plastic so that you don't wet the sheet or to protect the beddings. And actually continue the application for 30 minutes for a longer time when needed, and then end the treatment by removing the pack or drying the area. So this is a basic rundown of the treatment procedure. So I'd like to now pass the time to Diana to talk about the procedure. Now, before we go there, let me repeat this simple acronym, RICE. The RICE is this: rest if you are injured, rest your injured area for at least 48 hours. Then ice for 20 minutes at a time, 4 to 8 times per day. And then compress is to actually help with the swelling. And please remember to elevate as far as possible the injured limb 6 to 10 inches above the heart, so that actually the circulation will be there. So this simple acronym of RICE, which is rest, ice, compress, and elevate, is important. So this is the cold compress or cold pack. There are different things that we can use to have the ice cold effect, and we can now demonstrate to you exactly how can we carry on with this therapy by having it be able to be held in a part of the body for a prolonged period. Meantime, if you do have questions, please put it on our chat so that we can actually answer them one at a time after the second demonstration. Diana, the time is yours.
Okay, so now we're going to do ice compress or ice pack. Now, you can have something like this if you're able to get it. This is a nice thing where you can actually put ice into this bag and then just close it up and put it over the sprain or the strain or where you want to put the ice compress. Okay, this is an idea, but you don't need to have this because you can always use Ziploc bags like this. Because this is quite a large size, probably half the size is enough. Okay, so we want to do this on swelling, swollen areas to bring down the swelling, to slow down the blood capillary permeability, all right, so that the swelling doesn't get worse, and to prevent blue and black. All right, so usually this you do immediately when you have a sprain, a strain, or swelling, or edema, or you happen to bruise yourself or hit yourself against a hard surface and you get this inflammatory reaction with swelling, with blue black, or with heat, or with pain, and so on. This also helps to numb the pain. So we have already crushed some ice. If you want to use frozen millet or peas or something, because it's softer and more malleable, that you can wrap around the body surface. But I find that ice, crushed ice, is best because ice tend to retain the coldness longer. So you need to just make some ice cubes and then just crush it, and then. So let's pretend that Lorena has a sprained ankle. So what I do is either I use a flannel. This is a flannel cloth. If you don't have, not to worry, you can always use a towel too. Okay? So we wrap that around the leg, the injured area first. Okay? So let's say we just wrap around here. Okay, then we will follow that with this ice pack. So if the swelling is over here, then just put it over that area. Okay? And then we're going to follow that with plastic wrap to hold it in place. Okay. Maybe I'll just stick it out from here. It's faster. Okay, and we'll just tear it up. Okay, and if you want it to be more comfortable, or you can also secure with an elastic bandage like this. So you can go over it, okay, round and round. To hold it tight so it doesn't slip off. And normally we keep this in place for up to 30 minutes. Okay, and then we just secure it with a hook like this. It just will hold in place the cloth next to the bandage. Or if you do not have that, then just use a safety pin. Now you saw that the last thing we did was, the last slide showed the acronym RICE, R-I-C-E. R for rest, so she needs to rest that leg and not use it, otherwise she's going to do more harm than good. And she needs to have an ice compress, which we have already done. And then the E is for elevation. Preferably you have more pillows, higher pillows than this, so that you can elevate the foot more. Okay, these are just thin cushions. I recommend using thicker pillows. Or if the person wants to lie against the wall and then put the feet on the wall, so the elevation is higher or greater. This way, it will help to bring down the swelling. So it's a very simple thing to do, especially when people have sports injury. And you don't leave it on for more than half an hour, just 30 minutes is long enough. Then you remove it, dry the leg, okay, remove everything, dry the leg, and let the person continue to rest with the feet elevated. You do this for the first 24 to 48 hours of injury, at the start of injury, first day or two. After that, you do the contrast bath. Contrast, soak the feet in hot and then in cold, alternate hot and cold, like what we did earlier, for subsequent days to continue until the swelling is all subsided and the healing is complete. So it's something that is very easy to do, and you don't have to waste a lot of money buying expensive medication or having to go to the doctor if it's just a simple sprain or strain, because this is something that you can treat at home. Okay? If, of course, there is any fracture or things like that, then you have to be careful. And normally with fractures, you don't use the ice right away. Okay? So this is what we mean by ice pack or ice compress. Any questions? Yes.
Thank you, Diana. So with this, we can actually, since it's going to be a prolonged period of 30 minutes, can the patient be lying on the bed?
Yes, it would be a good idea. Now, if the person lies on the bed, then make sure that there's a plastic over the mattress or the bed sheet, just so that there's no wetting of the bed sheet. Just protect the bed sheet. Yes.
All right, thank you very much, Diana. So this is a simple way of doing a cold pack or cold compress. For example, this affected area is the feet, and then we can do it for a prolonged period, basically to encourage constriction. At the same time, the patient actually can also reduce the inflammation and the swelling. Now, Diana, there is actually a question about the hot-cold contrast bath. Pertaining to the first demonstration. It says here, we actually have mentioned that we should do a 3 minutes of hot and 30 seconds of cold in a cycle of 3 to 5 times. There's a question that asks, can we prolong it or extend it to like a 10 minutes hot, 2 minutes cold in a single session?
We wouldn't recommend that, because you don't want... prolonged heat has different effects from shorter heat, okay, and likewise with the cold treatment. So usually with ice cold, you don't want to really numb the person for too long or constrict the blood vessel for too long. So it's better to keep to 3 minutes hot. You can go from half to 1 minute cold if you want. And by the way, you can also do this as a whole body shower. Hot shower and then cold shower, okay? So we don't want the cold especially to be longer than 1 minute.
Yes, okay, thank you for that answer. So as a result of the tendency that prolonged duration of hot and cold can actually have other undesirable effects, which is why many of the publication has encouraged that we stick to 3 minutes of hot, and for the cold, it can be 30 to even 60 seconds. Right. Okay, is there any other questions that we may have pertaining to this particular cold compress or the hot foot contrast? Feel free to type it into the chat, and we're able to answer those questions right away. Meantime, maybe I have a question for you. We have mentioned just now that when a person is not able to feel the sensation like in diabetic neuropathy, we should refrain from actually doing this. And the reason is because we are concerned whether they can actually feel the coldness as opposed to a person that actually has normal sensation. Am I right to say that?
Yes, but I think you could still use a cool
instead of cold.
Compress.
Yes.
Yeah,
Actually, that was my question.
And
so even though we discouraged using the extreme cold, as in the ice pack, we can actually use the cool effect for those that are having so-called diabetic neuropathy. Okay.
Right. So you can just put cool water in a Ziploc bag and just wrap around. It's still better than not doing anything at all.
So now, for this one, for example, is after 30 minutes, how should we end the whole therapy?
Okay, let me show you. So we will just take off the hook, all right, and just unwrap the feet, the bandage. So just take the plastic wrap out. take out this and take the cloth out or the towel, and just, if the feet got wet over time, okay, if there's any, because of the water that cooled down, and if there is any wetness, be sure to dry the feet. And remember that a person should rest because the area is injured. You do not want to injure it any further. It needs time to heal. And try to keep the injured part elevated. Okay? So that will help to drain the water away from the affected area.
All right, thank you very much, Diana. So we have demonstrated to you this afternoon 2 of the hydrotherapy. One is the contrast bath, hot and cold, and now also the cold compress. And we will be willing to answer any question if you do have. Even if this session ends, do continue to text to the Maranatha chat group if you have questions pertaining to these 2 therapy. But meantime, we will be planning for more sessions if there's in the future, and we hope that you can join us. And for those of you that missed the first session about the hot foot bath and also the steam inhalation, so please watch our YouTube channel. Meantime, thank you for joining us, and we want to appreciate Dinah and also Lyrina for the demonstration this afternoon. We'll see you again. Bye-bye.